Okay. Hello, assalamu alaikum students. Today I'm going to give you brief introduction of inguinal canal, inguinal rings, so you can have a better understanding of these structures. So in this video, what we are looking at, this is deep inguinal ring. This is deep inguinal ring. Actually, this deep inguinal ring is a passageway to the inguinal canal. So when we move inward, we are inside the inguinal canal. But on outside here, we have got, this is superficial inguinal ring. Superficial. So it is kind of oblique passage. Inguinal canal is between the deep inguinal ring and superficial inguinal ring. So this is superficial inguinal ring you're looking at, but from inside here we have got deep inguinal ring. So it is an oblique passage between these two rings, and this passage is moving downwards, medially and inferiorly, oblique passage. So this here you are looking at deep inguinal ring. So this deep inguinal ring is basically a hole or deficiency in the fascia transversalis. Here you're looking at, this is all peritoneum, and beneath the peritoneum there is extraperitoneal tissue, and beneath that we have got fascia transversalis, which almost covers all the anterior abdominal wall or abdominal cavity, lines the abdominal cavity, anterior abdominal wall. So this deep inguinal ring is basically a deficiency in the fascia transversalis, and fascia transversalis is drawn along with the spermatic cord into the inguinal canal. So for example, if it means like that, if fascia transversalis is covering all that, its edges are being drawn into the inguinal canal just like a sleeve of a shirt. When you look at the sleeve of a shirt from inside, as the sleeve is, drawn along with the your arm. So this is deep inguinal ring. And here what we can see that these are inferior testicular vessels, testicular artery and testicular veins, then epididymis, and in case of males epididymis, and in case of female it is round ligament of uterus. They are within the sleeve of fascia transversalis around them, which makes the outermost covering, which is passes along these structures into the inguinal canal. So this is ductus deferens, testicular artery and testicular veins in the form of pampiniform venous plexus. And here when you look at from outside, this superficial inguinal ring, it is triangular in shape, this superficial inguinal ring, whereas round deep ring is round in shape. So this superficial ring, it is triangular, it has got a medial crura, lateral crura, and it has got an apex, and apex is formed by intercrural fibers. And this structure you are looking at, this is the spermatic cord. This is external oblique and this is internal oblique muscle, and beneath that we have got transversus abdominis muscle. This one is transversus abdominis muscle, as you can see. So the thing is that this is spermatic cord coming out of the superficial inguinal ring. After passing through, spermatic cord contains, as I showed, testicular artery, testicular pamphiliform venous plexus, genitofemoral nerve, and lymphatics. They come out of this canal through the superficial ring. And the superficial ring is basically a deficiency, or it is an opening in the external oblique muscle. So superficial ring is an opening in the external oblique muscle. Here you can see it is triangular in shape, and it has got two cruras, medial crura, then lateral crura and intracrural fiber. So deep ring and superficial ring, they are connected by an oblique passage of 4 centimeter length, which is inguinal canal. So about the inguinal canal, its floor, its anterior wall, posterior wall, and roof, I would be doing another video. But for now, I want to again focus on the deep ring, superficial ring here, superficial ring here. Now this is inguinal ligament. Like, what is inguinal ligament? Inguinal ligament is basically folding of aponeurosis of external oblique upon itself. It folds inward and gets attached onto the anterior superior iliac spine and pubic tubercle. So this curling of aponeurosis of external oblique basically forms the floor of the inguinal canal. So again, we have got two rings, superficial ring, here you can see deep ring on the other side. So when you look from outside, what is actual location of the deep ring? So deep ring is at the midpoint of the inguinal ligament, 2.5 centimeter, or just above the midpoint of inguinal ligament, we have got location of a deep ring. So this is a passageway, oblique passageway between two rings, deep ring and superficial ring, and it is oblique and it is almost 4 centimeter in length. Superficial ring is an opening in the aponeurosis of external oblique. And what is aponeurosis? It is a flat tendinous sheath of a muscle is called aponeurosis. So superficial ring is gap or opening in the external oblique muscle, aponeurosis, whereas deep ring is opening in the fascia transversalis. So spermatic cord and its structure pass through this opening and they come out of superficial after passing through the canal. And in this particular model, as you can see, these are inferior epigastric vessels. Inferior epigastric vessels. And here we have got rectus abdominis muscle. Rectus abdominis muscle. So here it becomes a triangle which is called Hasselbalch triangle, or here these are the boundaries of Hasselbalch triangles. So how we will basically explain these boundaries. Lateral border of the rectus abdominis muscle here in its inferior part, it forms the medial border of the Hasselbalch triangle, whereas lateral border of the Hasselbalch triangle is being formed by the inferior epigastric vessels, whereas inferior border is being formed by the inguinal ligament. So there on the internal surface of the anterior abdominal wall, we have got in its inferior part, we have got a triangle which is called Hasselbalch triangle, and this Hasselbalch triangle has got certain boundaries. As it is a triangle, so it would be having 3 sides. First side is medial border, lateral border, and inferior border. Lateral border being formed by the rectus abdominis muscle in its inferior part. Then lateral border is being formed by the inferior epigastric vessels, and inferior wall being formed by the inguinal ligament. So here we have got triangular area or depression. This triangular area or depression is basically a weak or potentially weak area from where inguinal hernia, direct inguinal hernia, it, through the weakness of this area, it can protrude into the inguinal canal, and then this hernia comes out of the superficial ring without involving the deep ring. So again, I would like you to concentrate. Deep ring is placed quite lateral. So this is the weak area through which, in its weakness in the wall, the contents of the hernia will protrude into the inguinal canal, and they will come out through the superficial inguinal ring without passing through the deep ring. So such a hernia is called direct hernia because it is directly coming out of the superficial ring, whereas the hernia which enters or through the deep ring, then it passes the inguinal canal, and after that, when it comes out of this superficial inguinal ring, that would be indirect hernia. So for indirect hernia, the herniating contents, they should have to pass through both deep and superficial ring, and for direct hernia, the herniating contents, they protrudes through the weakness into the Hasselbalch triangle area, and they enter the inguinal canal, and then they protrude through the superficial inguinal ring without protruding into the deep ring. So from outside, we can locate from the surface of the body where this deep ring should be present. And for that, what I have just told you, that inguinal ligament spanning between the anterior superior iliac spine and pubic tubercle, mid of the inguinal ligament, and just above the mid of the inguinal ligament, if we press with the thumb in live subject, a patient, when we put pressure here, we are actually compressing upon this deep ring. So if we are pressurizing upon the deep ring, hernia should not come out of the superficial ring as if it is indirect hernia, as this deep ring has been occluded. If still after occlusion, this test is called deep ring occlusion test. If still hernia is coming out of superficial ring when you have occluded this deep ring from outside like this, so it means hernia is passing through Hasselbalch triangle and coming out of superficial inguinal ring. Such a hernia would be direct hernia. So this was a bit difference in direct and indirect hernia, and in my next video I would definitely make you understand an easy way how to differentiate between direct and indirect hernia. Thank you very much.